Infection control is a fundamental part of nursing practice, and in aged care settings it becomes even more important because older residents often have weakened immune systems and are more vulnerable to infections. One of the most effective ways to prevent the spread of infections is through proper hand hygiene and the correct use of personal protective equipment known as PPE. As a nurse, your role in demonstrating and maintaining high standards of infection control helps protect both residents and staff from harmful germs. Hand hygiene is the single most important action to reduce the transmission of infections in healthcare settings. It involves cleaning your hands at key moments using either soap and water or an alcohol-based hand rub. The choice between the two depends on the situation. When your hands are visibly soiled or after contact with body fluids, you must use soap and water. In all other situations, such as before and after touching a resident, before performing a procedure and after touching the resident's surroundings, alcohol-based hand rub is usually the preferred method because it is quick and effective. When performing hand hygiene with alcohol-based rub, apply enough product to cover all surfaces of your hands and rub them together until they feel dry. Make sure you include the fronts and backs of your hands between your fingers, around your thumbs and under your nails. This process usually takes about 20 to 30 seconds and ensures that the hand rub has time to kill germs effectively. When washing hands with soap and water, wet your hands first. Apply soap and rub all surfaces thoroughly for at least 20 seconds, then rinse well and dry with a clean paper towel. Use the paper towel to turn off the tap to avoid recontaminating your hands. Personal protective equipment plays a vital role in preventing the spread of infections by creating a barrier between you and infectious agents. PPE includes gloves, gowns, masks, eye protection, and face shields. The type of PPE you use depends on the type of care you are providing and the risk of exposure to blood, body fluids, respiratory droplets, or other contaminants. For example, when caring for a resident with a respiratory infection, you would wear a mask and possibly eye protection to prevent inhaling droplets. When cleaning up spills or providing wound care, gloves and a gown may be necessary to protect your skin and clothing. The correct way to put on PPE starts with performing hand hygiene first, then putting on your gown, making sure it covers your clothing and ties securely at the back. Next, put on your mask or respirator, ensuring it fits snugly over your nose and mouth. If eye protection is needed, position it comfortably without touching your face. Finally, put on gloves, making sure they cover the cuffs of the gown so no skin is exposed during care. Avoid touching your face or adjusting your PPE and change gloves between tasks to prevent cross-contamination. Removing PPE must be done carefully to avoid contaminating yourself. Start by removing gloves as they are the most contaminated item. Peel them off, turning them inside out, and dispose of them immediately. Perform hand hygiene, then remove eye protection, touching only the straps, followed by the gown, which should be untied and pulled away from your body without touching the outside. Finally, remove your mask by handling the ties or loops and perform hand hygiene again at the end. This sequence helps ensure that you do not transfer germs from contaminated PPE to your hands or face. In aged care, infection control is not only about protecting residents from common infections like colds and stomach bugs, but also from more serious outbreaks such as influenza, COVID-19, or gastroenteritis. This means that consistent and correct use of hand hygiene and PPE is critical during daily care tasks, meal assistance, toileting, and wound care. Even when the risk seems low, always follow your facility's infection control protocols and stay updated on current guidelines from public health authorities. As a nurse, you are also responsible for educating and encouraging other staff, residents, and visitors to practice good hand hygiene and use PPE correctly. Leading by example and gently reminding others when necessary helps build a culture of safety and reduces the spread of infections within the facility. Infection control audits and training sessions are valuable opportunities to refresh your skills and ensure everyone is following best practice. Mastering hand hygiene and PPE use is a simple yet powerful way to protect vulnerable aged care residents and maintain a safe environment for everyone. By committing to these practices every day, you uphold the highest standards of nursing care and contribute to the well-being of your residents and colleagues.